Hospice Care Queen Brenda here. Patients almost never get a feeding tube while on hospice, but it isn't uncommon for patients to come onto hospice with one already in place. This situation can feel complicated at times. Families and sometimes patients think this is a great way to keep up hydration and nutrition so they can live longer and better. The thought of your family member dying of starvation or dehydration sounds and feels terrible. The reality is that food and fluids through a feeding tube for the hospice patient has the potential to decrease quality of life and put hospice patients at risk for events that can actually shorten life with an uncomfortable symptom burden. What is most important for the patient coming onto hospice with a feeding tube is that there are quality discussions about what are the goals of care for the patient and family, which are not always the same. This is okay. There are no right or wrong answers, but rather the connection of being heard and seen. Once we feel this, we naturally open up to options other than our own. The hospice team is familiar with the use of feeding tubes and the risk at end of life, which I will go into. And generally, they do encourage avoiding their use due to the potential side effects. Hospice does have a responsibility to inform and educate patients and families about risks and benefits, but ultimately, patients and families always have the choice to do what they feel is right. Over the years, what I have found is with gentle and consistent education, people see and feel the normal decline at end of life, and they come to the decision themselves to stop trying to give food and fluid through the feeding tube. The other thing we see is families say, my mother, father, spouse, whoever would never want to live like this, nor would they want to be kept alive, but I can't just let them die due to lack of food and fluid. I realize this may not make sense, but it is a huge burden for families to make choices for another family member who can no longer speak for themselves. And it's almost always seems safer to go with what feels like will keep them alive. Just acknowledging this burden for families can help them feel some freedom to honor what patients would want and not want. So here's some of the data or facts hospice will be letting you know about the use of feeding tubes at end of life. The body knows how to die, and it likes to be dry, quiet, and empty as it journeys toward the natural dying process. When we push food and fluids, either by mouth or by a feeding tube, it can overload the body and cause uncomfortable symptoms, such as nausea, vomiting, diarrhea, bloating, and cramping. The gut, or the GI tract, is one of the first things to start slowing, and if it has too much in it, things go up instead of down, and food and fluid can go into the lungs, causing aspiration, which can be very uncomfortable, resulting in pain, discomfort, respiratory distress, and patients can die sooner than later, and not in a comfortable manner. Food is a form of love, and at the end of life, it should be a source of enjoyment and comfort. As the body heads toward the dying, the appetite naturally wanes, and if our bellies are full of artificial food and fluid, the opportunities for those small windows of appetite to comfort and enjoyment from food disappear. Being tied to a feeding tube can also confine patients to a place and a schedule when they could be spending their remaining time doing what they want and being with the people they love. Infection and other complications can come from feeding tubes, whether it's a feeding tube via the nose or straight into the gut through the stomach wall. This is an artificial entry into the body, and at the end of life, our immunity declines and there's an increased risk of infection. Then there's the skin around a feeding tube that goes into the stomach. I can't tell you the amount of time as a hospice nurse I have spent trying to keep that skin clean, intact, and comfortable. And lastly, there's the psychological or emotional impact a feeding tube can have on patients and families. When the option to give food and fluid through a tube is available, it almost creates a sense of responsibility that we should because we can. And if we don't, people can feel quite guilty and a failure as a loved one, and that doesn't feel very good to anyone. The truth is, if a person's age, physical disability, and disease process qualify them for hospice, it's likely time to ask some hard questions and have some quality conversations. So clearly, this is a complex situation that takes time and patience, filled with education, in order to navigate it best for everyone. Feel free to ask Nancy and myself questions or give us your feedback and thoughts on our blog or our YouTube channel, The Hospice Care Plan. Click the link below and you can get a copy of our booklet, The Hospice Care Plan, helping families and caregivers take care of people at the end of life.